Good morning, Butterfield Trail Village. Go Hogs! Woo! I almost couldn't fall asleep last night. I was so excited, and the dogs were scared. They ran to the bedroom because I was screaming at the TV so loud. It was awesome. I'm so proud of the boys. And tomorrow night, 8:49, we will watch them beat Duke. Does anyone remember the last time Arkansas played Duke? Yes, 1994. We won that one. So I know those young men were so excited, and they probably couldn't go to sleep last night either. And that coach, Muss, is awesome. He's so awesome. Okay, well, I have just a few announcements. First of all, the resident directory will come out probably in a couple of weeks. There'll be a few upgrades or redos on the transportation schedule, so you'll want to read that. But one thing I would like to mention about medical appointments, it's very, very important that you stop and see Kelly at the front desk when you have a new medical appointment. That is the easiest way for us to keep up with that. Please don't leave notes on the transportation desk. They've been lost, misplaced, and we have a system that works to ensure that you get to your medical appointment. You can call and leave a message, correct? No messages on the phone. Okay, so you just, when you have your appointment, see Kelly if at all possible. The drivers usually aren't at the desk, as you know, because they're out driving. So we just want to ensure that you get your appointment at the time you need to go. And there'll be a few tweaks on the shopping schedule, nothing drastic, but you can read the schedule when it comes out. We're getting close to tornado weather, and I want to let you know that we are currently updating all of the phone numbers for weather call. Okay? We're doing all the numbers for weather call, and I will be putting out a memo that gives you direction on what to do in your living unit as far as a safe spot and protocol and things to do during a tornado. If you do not want to receive a weather call warning on your landline or your cell phone, you need to let me know, because otherwise we do everyone automatically just add you to the system. So some people just don't want to be receiving phone calls at 2 in the morning. I understand that. For your own safety, I would suggest that you do, but if you do not want to receive a call, let me know when you can. All right, April calendars were delivered yesterday. We have a busy schedule, and so I'm not going to highlight much of it today, but there's a lot of things that will require you to sign up. So I suggest you go through and pick the things you're interested in and go ahead and get signed up early. It's just going to be a really busy month, and it's going to be a fun month. So that's really all I have this morning. We have Patricia with a brief announcement. Then Gary. And then Kelly.
Good morning, everybody. Just real quickly, I want to remind everyone that if you are going to have a scheduled procedure done, to please let us know ahead of time, and especially if it's going to require you to stay overnight in the hospital. If you go to the hospital and we don't know about it, in other words, you weren't here, we did not call 911, and we weren't involved where we wouldn't know, please have either you call us or have someone in your family give us a call. It's very important that we know where you are, partly because if you're in the hospital, we want our transition social worker, Shelby Simpson, to know so that she can work with the case manager about your discharge back to Butterfield. The other facet of that is that we have a census that we keep. And so when we find out a week later that somebody was in the hospital, the person that does the census has to go back and adjust all those numbers. So it's so much easier on staff that do those censuses to get it right the first time. But the main reason is so that Shelby knows that you're there and can work with the case manager to work out any issues there might be about you coming back, and especially if you might need to go to health care. So if you would do that, that would be a really big help to us, and I appreciate it. Anybody have any questions for me? All right, go Hawks.
Good morning, everybody. Oh boy, everybody's still asleep. You need a joke? Well, you're in luck. I've got 2 new ones for you today. But before we get there, Quentin asked me to mention to you to use extreme caution and good judgment. You've probably seen in the news a lot of things about the Russians are going to start hacking everybody. Basically, just use good judgment. If you get an email from somebody, be sure you know who that's actually coming from. If you get an email from the bank or what looks like your bank or from a long-lost relative you haven't spoken to in a long time or the FBI or something like that, be careful. All it takes is just clicking on a link in something that you weren't expecting to get infected. Most hacks, they are done because somebody clicked on a link and installed a piece of software. So just use good judgment when you get those things. All right, moving on. Your 2 jokes. Some people said they missed the joke, so here we go. You can thank my wife for these. If you ever see the girl standing in the center of the tennis court, her name is Annette. All right. Joke number 2. Joke number 2. Do you know why the Oreo went to the dentist? Do you know why the Oreo went to the dentist? He lost his feeling. Yeah. All right, with that, I'll turn it over to Jay, I believe. Oh, no, Kelly. So here comes Kelly.
Hello, everybody. So, first, I just wanted to say thank you to the many, many, many of you that turned up to have your portraits made. I have been working on editing a few hundred of them, and so it's been quite a job, but just wanted you to know that that has moved along quite nicely and that we are going to be transferring all of the digital images that I've completed to a computer that the program and events team has. So they have a laptop that they normally use for production and things in here. We will be communicating a time that everybody, just a range of time that you can come and take a look at your portraits, and we'll have a little sheet that you can fill out that says which of the images that are included. And most people have 3 to 4 that I have completed for you. Which one of those you want to go into the resident directory, and then you can also tell us if you want copies of those images. We can send them to you digitally. So that means if you've got an email address or you have a family member who uses email or a neighbor who would be willing for us to send you those images, then we can send them to you digitally, and then you can get them printed just about any way that you would want to locally. So it also makes it easy for you to share them with family members or other people who might like to have a portrait of your beautiful face. So thanks so much for participating. Also on that topic, of course, we did not get every single resident in the sessions that we conducted up to this point. So I am going to be scheduling some makeup times. We're not going to do this all the time just because it takes me a lot of time to set up, and you know, we have to reserve the space for it. So we're probably going to do this roughly quarterly. That way we can pick up residents that would still like to have their portraits made and miss the option, as well as be able to pick up our new residents as they are moving in and make sure that they get included in the directory as people come. So looking forward to seeing that completed, and I think you all are going to get some really great use out of it. One other thing I was going to mention quickly is that on Thursday of next week, I think it's the 31st, we are going to have the finish up of the young woman that comes in and is taking pictures on the interior part of our campus now to help us build this really cool tour that is going to go on our website. I don't know if you've seen these before, but there's a 360-degree tour that she's able to do. So she goes into outside spaces, indoor spaces, and she has a special camera that spins around and takes a picture, and they weave all this together. So then if you go onto our website, once this is all done, it's like you're walking through Butterfield, through different buildings, like you're walking down our streets and our sidewalks, and it gives people an idea of just how amazing this campus is and the facilities that we have here. So I just wanted you to be aware that she's going to be on campus next Thursday. One of us from the marketing team will probably be with her most of the time, just making sure that we can sort of manage any traffic that's going on. She's very fast, but please be patient with us if we pop into a gym or maybe the library or a space where somebody may be there. We may ask you just for a moment to let us capture some pictures so that we can get that done, and we'll be in and out. So look forward to sharing that with you when it's completed. So y'all have a wonderful weekend.
Thank you, Kelly. Hi, guys. Jay Green here, Director of Healthcare Services. Good morning to everybody. I wanted to give an update because last week I had some special guests in healthcare and special care. Last week we finally received our annual inspection from the Office of Long-Term Care. They showed up at about 6 o'clock on Monday night, which was odd. But what it is, and I talked to the surveyors, so many of these surveys, they have to do off-hour entrances. So instead of showing up at 8 or 9 in the morning on a Monday morning, they decided to use Butterfield as the 6 p.m. entrance, which was fine, all things considered. But as I had finished cooking dinner at the house and was messing around with the kid, and I looked down at my phone, and I had 4 staff members that had texted me and said that State's in the building. I quickly got my things back together and came right back up to Butterfield. And when I arrived at the door, the surveyor sat there looking at her watch saying, "What took you so long?" And you know that it's always going to be an interesting week when you have something start out like that. The good thing is that the surveyor was joking, that she has been to Butterfield many a times, and she knew it. I'd probably already gone home. She did not expect the administrators to still be there at 6 o'clock when they came in. But nonetheless, that's how it started. They stayed with us till about Thursday afternoon at about 1 or 2 p.m. and then made their exit. It was a very good visit. They were very complimentary. They always do give me the impression, but this time they even mentioned it again, how much they enjoy coming to Butterfield. Out of all the facilities that they have to go to in the state of Arkansas, when they come to Butterfield, it's a reprieve for them. It is a different scenario. Of course, you know we have a different operation, and I'm very proud of that. I'm proud that when they come here, it feels like a vacation in comparison to going to other nursing facilities. So that, hands down, always makes you feel good. But nonetheless, they dig, and they dig some more, and they look for any little thing that they can find that we weren't doing as appropriately as they would expect. And that's fine. That's their job. I respect the process. I really do. I do enjoy, or not, maybe not enjoy is a bad word for that, but I do appreciate the fact that we do have checks and balances, that we do have another organization that'll come in, review our information, and make sure we are doing everything as good as what we can do. Because there are times, and you know as well as I do, that you get in a habit and you get in a groove and you feel like you're doing everything in the world that you're supposed to be doing, and you may miss some things. And so sometimes that does occur. This last time they found 4 things that they would like us to work on and correct. All of these things are inserviceable, meaning that just need some further training for staff. None of these things involved immediate danger to any residents or staff members, and none of these things involved hands-on care. And so that made me very happy, because when you think about the fact that everybody that has to have assistance with dressing themselves, bathing themselves, cleaning up, going to the restroom, people with trachs, people with catheters, anything and everything, if they couldn't find anything with the hands-on, that's a great sign. It really is. And so, without further ado, let me tell you what exactly they did find. And I'm going to explain it in layman's terms, but if you would like to talk later on, by all means, I'll be more than happy to dive further into it with you. But one of the deficiencies that we received was failure to properly store and label food. Now, when you go back to your apartment, I want you to look through your cabinets and your pantry, and I want you to make sure that every single item in there is not out of date, that every single item in there is completely sealed, and sure, go ahead and put a date on when you opened it. Go ahead and do that too, because that's the level that they get to. And if you've ever been in the Butterfield kitchen that serves over 400 people on this campus, there's quite a bit of food items in there. And so one thing, not having a cover on it, not having a date on it, will get you this deficiency. So in saying that, it's that simple. If you have bread that expired yesterday, and even though I at my house go by the old school rule, if I see no fuzz, then I'll continue. Even so far, and I know I'm not alone in this, even so far as if you do see fuzz, to rip it off, throw it away, and continue to eat that hamburger bun. Don't say you haven't done it. I know you have. So, but it's that simple. It's that simple. And I expect that, and that is perfectly fine. That's perfectly fine. But that was one that we did receive. Another one was failure to follow the menu. Now, in terminology, that may sound interesting, but in reality, on this one, in healthcare, and I don't know if I've ever directly told you, but in healthcare, especially in the regulated area, we are required to give a certain amount of every type of food on the tray. For example, 4 ounces of a starch, 8 ounces of protein, 4 ounces of dairy, stepping over myself here, dairy, things such as that. Those can be very confusing. And they can be very intimidating when you have a state surveyor standing over your shoulder while you're traying up trays. And it's very easy, and I would do it myself, to grab a 2-ounce scoop instead of a 4-ounce scoop and scoop mashed potatoes up. Now, the resident that received 2 ounces of potatoes instead of 4 ounces of potato did not have any weight concerns or anything like that, so that failure to follow the menu by using the appropriate scoop size did not affect this resident's health, but it is one of those top things that if you don't use the right scoop, it's a ding, and it's easy to do. So again, that's a staff training issue, and we are already on top of that. So, and then going to the laundry room. Next time you're in your laundry room or any laundry room, double check that lint trap. Double check that lint trap to make sure there's no excessive buildup of lint. Now, out of all the environmental things on this campus that they could look at, and I don't know if you've ever been to special care recently or not, or seen the floor walking through healthcare that I'm working on trying to find a better solution for. But out of all the environmental concerns, the best thing they could find was that our lint trap had a little too much lint still left on it after they had cleaned it out. That's an education moment too, and that's an easy fix. Now, true, I do agree with the surveyor from the standpoint of any buildup of lint around electrical components on a dryer can cause a fire. Yes, exactly, 100%. I also know that that's pretty picky when you're at the very back of the machine down there and saying, does that look like a little too much to you? I wasn't going to say no to the surveyor when she asked me that. I said, yes, ma'am, we need to fix that. So that was our environmental side of things. And then going back towards the other half, the nursing side, again, if they couldn't find anything wrong with my peri-care, with my trach care, with anything that we do to touch the residents, they got us on a paper thing. And I call them paper tags because it's about documentation and so forth. And it's failure to properly assess a resident on psychotropic medications every 14 days if they're on a PRN. Meaning that PRN means as needed. And some residents do receive anxiety medications and other orders on an as-needed basis. You know as well as I do, there are certain days where you may need it and you may not need it. Well, this certain resident and the certain rule states that if you're on a mood-altering drug, your physician, and if it's not scheduled means you're getting it routinely every day at this time, this time, and this time. But if it's not scheduled, then the physician has to review your chart every 2 weeks to make sure you still need to be on that drug. And it kind of goes back to the old school mentality of the old standard would be is that you put everybody on Ativan. You never knew when they were going to have a good day or a bad day, so you'd put everybody on Ativan so you could use it if they were having a bad day. Well, when you do it in that manner, it's almost like you're chemically restraining somebody. You're using chemicals, you're using drugs to get them to behave or to act like you want them to, and that's not good. And I'm definitely against that. But given this one, they were looking at a hospice resident, of all people, and a hospice resident, in my opinion, is different. It's different because their journey is ever-changing. And yes, everybody's journey changes, but theirs can change so rapidly and so quickly, and pains and mindsets can change so quickly that yes, Ativan is not a surprise to have for somebody on hospice, because the pain that their body is going through will be upsetting, and it'll cause their blood pressure to rise and their anxiety to go up, and sometimes that is appropriate to give an Ativan to help calm down. But in that saying is that no matter what, if you're on hospice or not on hospice, a physician needs to be reviewing every 2 weeks if you're on a PRN anti-psych medication. So I say that as a paper tag because that, again, is a training thing. Training in regards to our administrative staff and also the physicians that we work with. Because I'll tell you, when we called the hospice company and said, hey, did you know that you have to do this? We're like, what? We've never been told that before. It's like, well, you've been told now. And so, nonetheless, our hospice groups that we work with are very understanding and very open. And this has already been corrected, actually. And no action that had been done on not reviewing affected the care of the resident. So that was very good. So when you put these things in perspective, out of all of the mountains of regulations that you can, and if you've ever worked in any organization that is regulated by the federal government, that's all I'm going to say about that. You know that it's interesting, to say the least. And to a certain extent, I understand. They have people to answer to as well. They can't just come into a facility and say, oh, they're perfect. That gets the wrong connotation. That you don't sometimes, and I hate to say this because I personally take all of these as a hit because I want to be perfect, but there are times you don't want to be too perfect because then you'll get attention from federal regulators, and they really, really enjoy their job, and they really enjoy making my hair fall out. And so, nonetheless, I'm very proud of our team. I'm very proud of the care that we give to the residents. And I just wanted you to know that these were the things that they found. These are the things that we are going to correct and or have already corrected, and we'll move forward. Now, we will continue to look for ways to improve the care at Butterfield. We always will, and we always have. But these are the things that the official documentation paperwork will show up on our record. So I do not believe that these reach the level of affecting our 5-star status in any way, shape, or form. But we'll see how that plays out down the road too. So regardless, I wanted you to know that every year we do get inspected from the state. I wanted you to know what these were and the general gist of them, and know that you are still at the premier place that you could be to receive care. I truly believe that. I believe that if you go down the road, you go across town, you go 15 minutes up the street, you will not receive the same level of care. And I hate that. I hate that because our industry, you've seen reports in the news and so forth, it's tough. It's very tough, and more resources need to go to senior care. But we've got a good thing going on here at Butterfield, and I'm proud to be the administrator of the healthcare center. And so if anybody has any questions, I'll be happy to talk to you more about these in depth. But I wanted you to know that first and foremost. Last two things, do not get rid of these. Okay? Please do not get rid of these, especially if you plan to come visit somebody in healthcare or special care or the assisted living. You still have to wear a mask. As much as I enjoy coming out here and taking it off, and it is a reprieve every time I do, the moment I step foot in healthcare, I have to put it back on. So that goes for staff and visitors both. Okay, so please don't forget that. And then also, I know that many of you are very familiar with residents in healthcare. They're your friends, they're your former neighbors, and sometimes family members. Please keep them in your prayers, always. We have 6 residents on hospice today out of 42, which is a high percentage. And that's nothing to say about the care, that's just the journey of life. And so, yes, I have a feeling there will be a few more announcements in the future on the board. But just remember that we take that very seriously. And up until the moment that the good Lord decides to call anybody home, they're family to us. And so just keep them in your prayers as well. Other than that, you'll have a wonderful holiday or weekend. I want to say holiday, but we're not there yet. But have a wonderful weekend. And I really should have planned this better because I had a Razorback shirt on yesterday, and now I'm wearing Duke blue. So I'm fixing to go back to my office. So y'all have a great morning.
Well, thank you, Jay, for that detailed update, and yeah, and get that Duke blue off. So, I was pleased to hear Ricky make mention of our busy April calendar, and I was thinking, man, that is so much difference than 2 years ago when we were announcing everything we were closing down and shutting down, and it is really nice, pleasing to me to get back to a busy April calendar. So I'm really pleased and glad to see that. I'm also, I don't know of any positive COVID cases at Butterfield that I'm aware of standing here at this moment, either residents or staff. So that's, once again, some more good news. So, the COVID's still out there. We've kind of just brushed it aside and said, well, we're done with this. But, keep in mind, it is still out there. So just keep that in your thoughts as you go about your daily lives. So hopefully we won't have to do any more cancellations or shutdowns is what my hope is. So I really don't have any new stuff to bring up. I'm just going to touch on some existing issues that we've been dealing with for many months now. But supply chain issues, we're still having trouble all across the board getting in materials for construction, food stuff. It continues. We're thinking maybe things are starting to turn the corner. And maybe that's just our wishful thinking, but Memo's still having trouble getting the kinds of foods he wants in the dining room. We're still having trouble getting our right construction materials and tile. Of course, also hiring and labor issues is still a big concern. We're still having trouble hiring, especially skilled labor in construction, all the way from skilled labor in construction to the dishwashers in the dining room. It's across the board. So. I've heard some residents say, well, when are we going to open a bistro on Saturdays? I would love to. I'd love to open it today. I'd love to open it tomorrow. We just don't have the staff. Well, when are we going to open the green room back? I'd love to. I'd love to open it today. We just don't have the staff. So the answer to the question is I don't know when we'll open these things. It's when we're able to get staff that we can open them, we'll do so immediately. So these things are cramping the type of services we want to provide here at Butterfield. We're not able to have the full use of our facilities that I would really love to have, but at the same time, it is the reality that we have to deal with, and we're dealing with it as best we can. So I appreciate your patience and understanding in those areas. To follow up on what Gary was talking about on cyber attacks, if you get a phone call and they mention immediate payment in the phone call, it's probably a scam. Especially if they're from a government or the FBI or the IRS or the police department and they need immediate payment, it's 9 times out of 10 a scam. If they mention payment in gift cards or Bitcoin, it's 10 out of 10 times a scam. So those are some dead clue giveaways that you just need to hang the phone up. So anyway, if they mention immediate payment, especially in Bitcoin or gift cards, it's a scam. So. The final thing I have on my list, and I want to talk about just a minute, is our special care remodel. We have picked that back up again and are proceeding on with our special care remodel. We have a meeting with our committee on April the 5th to review some selections and materials. Have a lot of concerns about this project, just like I was talking earlier with, once again, the material availability and in labor. We've also got a concern with the construction crews and the regulations in healthcare, because any contractors working in healthcare have to be fully vaccinated. So all the staff that's working in healthcare have to be fully vaccinated. So Getting construction workers that are fully vaccinated is a challenge. Getting construction workers, period, is a challenge, and then getting ones fully vaccinated is a challenge. So we're going to have to spend some time making sure that we're complying with the federal regulations in that regard. But we are going to try to move forward with this project as fast as we reasonably can. We've approached an architect. We've had the interior designer dust off the information and the things we had looked at 2 years ago before COVID hit. Don't have a good ETA yet, but we are moving forward with this project. I've heard some rumors that Quentin's cutting it back some. The answer to that is no. We can't cut it back because we never really had decided what we were going to do to start with. We're going to remodel special care, but we had never decided exactly what that entails and involves. And we're starting back on that process again. So we're going to hopefully do what is needed. The reason I say hopefully on that is because of budget constraints. But we have not cut the budget back. We are currently looking at what we call the scope of work, and in layman's terms, that's what we're going to do. But we're looking at the scope of work to see what needs to be done, what that's going to cost, and then can we afford to do all that or not? And we think the answer to all those questions is yes, that we can do what needs to be done, and we can do so within the parameters of the dollar amounts that we were thinking we would spend for doing this. But we haven't got to that point yet. It may be that that things won't cost as much as I think, and we'll have some extra money and we can do some more stuff. It may be that we don't have enough money and things are going to be a lot more expensive, and we may have to make some decisions as far as what we're going to do. But we haven't cut the budget. We haven't cut anything back at this point. We are still in the process of figuring out what it is needs to be done and how much is it going to cost. I've also had a couple of residents tell me that they've heard that I was really conservative, and they're glad I'm conservative in our spending. I apparently didn't realize this, but apparently there's some concern out there that maybe I'm too conservative and not free spending enough with your money. I assure you, I'm very aware that I'm spending your money, each of you individually and then collectively together as quote unquote the residents of Butterfield. And since this is not my money, I feel I owe a very high due diligence or a very high standard that I need to meet as far as, is this reasonable, is it needed, and is it appropriate, and is it prudent? These are words that my staff hear me say all the time. So, those are the criteria we look at. So, if you want things plated with gold, we can do that. It just costs a lot of money. Do we need things plated with gold? No, we don't. We can spend a lot less money and have very nice products and very nice facilities. So, anyway, that's always the challenge. But if you think I'm conservative, you're right. I am conservative. I feel I should be with spending your money. Sometimes I'm criticized as being too conservative, and maybe in that way I am too. But I do, want to always get it right and not be right is the saying that I always say. So anyway, those who have complained I'm conservative, you're right, I am, and I'm proud of that actually. So hopefully not too conservative. But with that, I'll leave that alone. And I think was there anything else I need to bring up? I'm looking at Patricia over here. I don't know. Should I mention our committee meeting yesterday, Mort? Do you think, is that appropriate? Maybe, maybe not. Butterfield has to pay what we've called the bed tax. The official name for it is quality assurance fee. What that is that's a tax levied by through the state of Arkansas on nursing homes, and it's to get the federal match on Medicaid dollars. Of course, Butterfield doesn't do Medicaid. Nobody at Butterfield qualifies for Medicaid. We don't do Medicaid billing. We don't have Medicaid patients. We're not even set up to bill Medicaid. We're not a Medicaid provider. So the residents of Butterfield have paid approximately $4.7 million over the life of this tax for something that we have no opportunity to receive any benefit from. We won't receive any benefit from it. So why do we have to, when you drive down the road, you pay the gas tax, you drive down the road, so you're getting some benefit out of the tax you pay. Well, why do we have to pay a tax where we can have no opportunity to ever receive any benefit from it? The residents of Butterfield, I think the ad hoc committee, I'm not sure if it's the resident legislative committee exactly, but we've tried many, many times to get this tax, or to get Butterfield waived from this tax. Yeah, very unsuccessfully so far. We've got a group of residents who have picked up the challenge once again. I think this is the third or fourth time this group has made this attempt. But and I'm just going to mention a few names. But Helen Mackery, Mort Gettleman, Betty Lou is on it. Ann Henry, Roy Penny is here in the audience. He was there. Larry Masters, dang it, Adela Gray. Who else am I missing? Yeah, Rory Clinton is on it, but we've met once before. We met again yesterday trying to devise our strategy. Don't know how much of a likelihood we'll have any success this time versus the last times that this committee or the residents that's working on this have failed. But I did want you to know that this group of residents has picked up the challenge. They're carrying it forward. They're spending their time and their energies on researching this for your behalf, and are trying to get this tax that we have to pay. It's $25,000 a month is a number I'm recalling, to try to get this thing. Is that right? Is that way too much? I think that's somewhere in there. But anyway, trying to get this thing repealed or waived for Butterfield so that we don't have to pay this tax. So when you see these individuals, just thank them for their time. They're spending considerable time and effort, and we're probably, I start to say we're probably going to fail, but maybe I'm being too pessimistic. Maybe we will succeed this time where we have failed in the past. But the important thing I want you to know is these individuals are working hard on your behalf, and they're spending their time. So when you see them, thank them for their effort and the work they're doing. So even if we're not successful, they're at least attempting to do really good things for Butterfield. So. And with that, I'm going to open it up to questions. If anybody has any questions for us today. Nancy. The question is about the hairnets in the dining room. Jay, do you know the answer? Because honestly, I don't know the answer to that question. And Memo is not here today. So Jay, you take a stab at it.
I'll be happy to. No, they will not be wearing hairnets in the dining room for serving. When the state came in at 6 o'clock that evening, and the only dietary staff that were left in the kitchen were dishwashers, the dishwashers were not wearing a hairnet. The state surveyor told us that everybody, regardless of what your job is in the kitchen, has to wear a hair and beard net. We got a little, let's just say, scared, so to speak. And so next thing you know, they had decided that everybody was going to wear a hairnet as long as state was here, regardless of what job description. Because if you don't know, I've got a stepson that's one of those servers out there, and he even came home and said, I had to wear a hairnet tonight. And I said, well, I doubt you have to wear that much longer. But the thing is that at the time when they came in, we did not have our hairnets on when they were washing dishes, and so we wanted to make sure and get it right. And then after speaking with them before they left, they confirmed that no, we don't have to wear hairnets while serving in the dining room. But yes, if you're in the kitchen area, the moment they step in there, they're working with food, they're working with plates, they're working with utensils, things such as that, they have to wear hair and beard nets. So, did that answer your question? There's a certain amount of lineage, almost like a boundary line, so to speak, because you're right. They do have to go into the kitchen area to receive the plate, but they're not in the serving line, they're not in the preparation line, they're not in the cleaning line. From the moment of just grabbing the food that's been prepared to simply take it from the final runoff to your plate, those servers do not have to wear a net. No, ma'am. They are as close to the food. It is interesting from that standpoint because you're right. The moment that I bring a plate to your table and lean down to put it in front of you, yes, any one of these little suckers could come right out. You're exactly right. but the regulation only states in those designated preparation and cleaning areas. So just like when you go to Olive Garden or Red Lobster or something like that, those servers, servers that bring you your final plate, they have to go back in the kitchen. They have to get the plate from the kitchen, but they don't come out of the kitchen with a hairnet or beard net on. And so same principle. And like I said, on that given day that every server was wearing a hairnet, that was us trying to make sure and almost make a point to ourselves, but at the same time make sure that we were doing the right thing. But we did receive clarification. There is a boundary line, so to speak, where you do and you don't have to wear a hairnet. And so your servers in the dining room will not be wearing hairnets. Yes, ma'am, Nancy? Not mask. Do the cooks in the bistro, are they required to wear a mask? No, ma'am. No, ma'am, they're not. And part of that aspect of it can come from the difference in who they're serving. Who they're serving, and in regards to the fact that when they're preparing food and such in the main dining room, that food's going to come down to healthcare. That food's going to go to assisted living and things such as that. In the bistro, much like your Starbucks or any other local restaurant, so to speak, you don't have to go by always the same rules. When the state regulators came, they looked at the main they looked at the main kitchen, they looked at the kitchens in healthcare, but they didn't look at the bistro because that's not considered in a regulated area. Now, the Arkansas Department of Health, they independently will come and inspect the bistro, much like they would a McDonald's, much like they would Brahms, or anything such as that, because that is considered more of a public service aspect of it. Once you go to the dining room, now granted, you can bring guests and things such as that, you're part of a private group of people that can eat in that dining room. And so forth too. The food that's prepared in the kitchen goes to healthcare, special care, and assisted living. That covers them under the umbrella of regulation. And so that's why you will not see masks being worn by the staff in the bistro. Yes, ma'am?
You want to take that?
It's kind of a half and half. Yes, there's talk, nothing in stone. Nothing in stone. So nothing for us to get to the point that we haven't started organizing any more clinics or anything such as that manner. We're watching it very close. And the question was, is there talks of a fourth vaccine dosage, a fourth shot, another booster? And yes, but the talks only go as far as what you and I have both heard on the news. So nothing official yet, but as soon as something does become official, you can bet we'll be right on top of it.
The question is daughter's coming to visit and she can't go in the dining room even if she's fully vaccinated? And the answer to that is yes, that's correct. She cannot go in the dining room. The reason for that is it has nothing to do with COVID per se. It's just because with staffing. We're struggling to keep enough staffing to keep the dining room open. And we're going to want to not target is the wrong word. We're going to want to let our residents go first. And if guests are coming in, then residents may not be able to eat in the dining room because of those guests, and we don't want that happening. So that's why we're asking you not to have guests in the dining room until further notice. And as soon as we can get staff hired where we can be able to seat everybody and work the full dining room, then we'll remove that restriction. So that's just a pure staffing thing, not a COVID thing. So, but thanks for your understanding and patience on that. Once again, for a while longer. So you can go in the bistro and eat with them because the bistro is designed to be just a first come first served basis. So, question over here. No, we have opened it up to Carriage Club. Since they are on the wait list and have paid a deposit, we are allowing them to eat in the dining room. They have to call marketing and make reservations, and then marketing alerts the dining room how many's coming and on what days. Is that correct? Yeah. For those in TV land, Kelly was saying that marketing is controlling the number of Carriage Club members that are eating any given day. And when they make the reservations, we're making sure we're not overloading the dining room and we're keeping them spaced out. And so far, it hasn't caused us any issues. So if you're in TV land, that was the discussion that was going on here. Yes, ma'am, you have a question in the back? Yes, you can still do carry out for yourself and guest. So, because we're generally able to get enough people to cook the food. It's generally the servers to serve you at the table is where we're having the main issues at. So that's why you could do carry out, but you can't do sit down dining in the dining room, for example. Well, any more questions before we adjourn our March 2022 town hall meeting? No? Well, thank you for coming, and hopefully we'll have good weather, and the good Lord willing, I'll see you here next month for our April town hall meeting.